Hi friends, I'm Dr. Rohit Prasad, lead consultant for ENT, cochlear implants and NTS pelvis surgery at Vikram Aura Hospitals. I'm here to talk to you about congenital hearing loss. This means only one thing, that the child who's born cannot hear from birth. The child who's born without hearing has two issues. One is they cannot hear what's happening, and because of absence of hearing, they are not able to speak. This is noticed in children who are born to mothers who have issues or infections during the first trimester of pregnancy, or probably they had issues during the time of delivery or post-delivery. The child had some issues where the child was having high-grade jaundice or had hypoxia during birth and had to be admitted to an ICU, basically a neonatal ICU. These children, when they grow up, they are unable to hear and thereby they don't develop their speech. Congenital hearing loss in children has to be diagnosed very early by a process of universal newborn hearing screening program that's present all over the world and has been implemented all over the world. These children can be tested on the day they are born by doing a simple test called as photoacoustic emission test. By doing this test, you are able to identify whether the child has hearing or cannot hear. Sequentially, further testing at age of 12 weeks will give us an idea whether the child has hearing loss and what kind of hearing loss and what is the nature of the hearing loss. Once we figure out the child has some hearing loss, it could be mild, moderate, severe or profound, the child has to be immediately addressed and provided the necessary kind of treatment options so that the early intervention enables the child to hear and thereby develop the adequate speech. Also, radiological testing has to be done to identify whether the child has any structural deformities in the ear, which is basically the inner ear, and the neural structures, which can also be a problem and can lead to this hearing loss. Eventually, such children might require hearing aids, and in those children who cannot hear at all, will require an early intervention with a cochlear implant. To know more about it, if you have any such issues, you can visit us and we would be glad to help you.